In today's health alert, with coughing, sneezing, and other symptoms going around, how can you tell which illness you might have? Our chief health editor, Dr. Parthanandi, here with us now to break this down. And so many infectious diseases are out there now. Does it even matter if you know exactly what you have?
Yeah, that's a good question, right? For most healthy people, Simon, mild symptoms like a runny nose, congestion, or feeling tired usually don't require a doctor's visit. Rest, plenty of fluids, over-the-counter meds like ibuprofen or acetaminophen, Tylenol are usually enough to ease fever or discomfort. But, if you have diarrhea, vomiting, stomach cramps, that's probably a stomach virus, right? Like norovirus. Testing usually isn't needed since most folks recover on their own. But there are exceptions, of course. If you're older, pregnant, or have underlying health issues, well, then you're higher risk for serious illnesses from COVID-19 and the flu. In these cases, early testing is crucial so antiviral treatment can start right away. And for young children, babies, and the elderly, and folks with chronic kidney or heart problems, they should see a doctor sooner than later if they have severe diarrhea and vomiting. Also, staying hydrated is super important for these groups. As for symptom severity, this matters regardless, Simon, of risk factors. If someone is very sick, they should be tested and see their doctor. It's also possible they could have pneumonia or bacterial infection, both of which often require antibiotics.
Yeah, Doc, oftentimes it starts off with just a sore throat, but then the symptoms get worse. When should you go to the ER?
Yeah, so sore throats typically, Simon, clears up in a few days, especially if it's caused by a virus like those that cause the flu or the cold. But sometimes it could signal something more serious like strep throat. Now, strep is more common in kids, we know, but adults can get it too. A super quick test can confirm the diagnosis, and antibiotics can help reduce the severity and prevent complications. Now, when should you head to the emergency room, right? When should you go to the ER? If you have chest pain, trouble breathing, numbness, weakness in an arm or leg, please don't wait. Go to the ER right away. And for less urgent symptoms, call your doctor's office for guidance. If you can't reach them or don't want to wait, an urgent care may be a good option for you as well. If you're a parent of a newborn, please call your doctor if they have a fever, trouble feeding, or seem unusually fussy or sleepy, or go to the ER if it seems even more urgent. Lastly, for folks with weakened immune systems like those on chemotherapy or organ transplant recipients, please know that even mild symptoms can become very serious. When in doubt, always better to get it checked out and talk to your doctor. We're talking about that. Don't go online and check. Just talk to your doctor and get sound advice.
Yeah, so important to know, and each individual case is different, so don't assume you're in the same situation as another person.
Exactly. You go down the rabbit hole and you get bad information.
Yeah, Doc, thank you so much.
Hey, my pleasure.
Good to be with you.
Of course.
And if you have a health question for the doctor, you can email him, Dr. Nandi at askdrnandi.com, or send it to us on Facebook or on X.